Today on the podcast, we're talking about twin pregnancies and recognizing the signs of postpartum depression.
You're listening to the Life with Multiples podcast, the show for new and expectant parents of twins, triplets, and more.
We're Chris and Kathleen, your hosts and triplet parents. We've survived life with multiples, and you will too.
So we called this episode, Are Twin Moms More Likely to Suffer from PPD, aka postpartum depression? And the answer is unfortunately yes. Mothers of multiples are more likely to experience postpartum depression. Statistically, moms of twins, triplets, and more are 5 times more likely to be diagnosed with postpartum depression. So it's important that new and expectant parents of multiples are aware of the signs and symptoms of PPD.
That's moms as well as partners. It's important that dads, partners, friends, and families are all aware and on the lookout for signs of PPD. So at the end of this episode, we're going to tell you how you can download a free print-off so you can have a copy of the signs and symptoms of postpartum depression so you and your support network can be aware of the signs and recognize the symptoms.
This is especially important because with something like postpartum depression, you don't always recognize it in yourself. So stay tuned till the end of the podcast for instructions on how to access that printable list of signs and symptoms. But first, we should give a disclaimer. The following is intended as general information only. If you or someone you know has specific health concerns, please consult a healthcare professional. Okay, so what is postpartum depression? Postpartum depression, or PPD for short, is a medically recognized mood disorder that can affect mothers up to 2 years after giving birth. PPD is commonly associated with a drop in hormone levels, and with a multiple birth, the fluctuation in hormones can be significant. About 10% of mothers suffer from PPD after giving birth, whether it's their first birth or not, and mothers of multiples are 5 times more likely to experience PPD. PPD commonly occurs within a month after delivery, but it can occur a couple of days or possibly months after giving birth. In some parts of the world, postpartum depression is called postnatal depression, or PND, but it's the same thing. PPD is a severe form of depression that requires treatment and should not be confused with the baby blues. The baby blues is also a hormonal or physical condition that for 85% of mothers occurs within the first 7 days after childbirth. However, unlike PPD, the baby blues will typically only last for a few days or weeks. The baby blues can be accompanied by feelings of exhaustion, bouts of crying for seemingly no reason, irritability, and insomnia. While the symptoms can be similar, PPD is much more intense, will interfere with everyday life, and can keep a mother from going about her daily routine. Everyday coping strategies aren't effective in combating PPD, and if you experience any of the symptoms mentioned in this podcast, treatment should be sought immediately.
We'd like to tell you about the Life with Multiples Academy. It's a private members area that we've created especially for parents of multiples so that you can get the tools and information you need.
Having twins, triplets, or more is a unique experience, and getting the right information at the right times is essential for a happy and healthy life with multiples. So whether you're currently pregnant with twins or have already welcomed your babies into the world, the Life with Multiples Academy is where you can get the answers you need.
Your membership will give you access to our growing library of multiple specific prenatal and parenting information, training videos, and downloadable resources. And it's also a way to connect directly with us and other parents of multiples who can help give you advice and answers to all of your questions.
Don't make life with multiples harder than it needs to be. Join us in the Life with Multiples Academy and make your new life easier.
We'd love for you to be part of this growing community and can't wait to meet you inside.
To learn more, head over to lifewithmultiples.com/join. While postpartum depression is a serious and debilitating condition, it is treatable with a combination of antidepressant medications and/or counseling. So, it's important to know the signs of PPD in advance so you can recognize them in yourself or your partner. If you're pregnant right now, you should familiarize yourself with the following symptoms and discuss them with your partner so that partners can be on the lookout for signs and symptoms. Signs and symptoms can include, but are not limited to, feelings of extreme doubt or guilt, feelings of overwhelm and hopelessness, inability to cope with day-to-day life, a sense of worthlessness, crying for no apparent reason, chronic fatigue, anxiety attacks, loss of appetite, unreasonable compulsiveness or obsession over the baby's care and well-being, or ignoring your baby's care, inability to concentrate or indecisiveness, suicidal thoughts. If you or your partner experience any of the above symptoms, please don't ignore them. The more of these symptoms that arise, the more likely it is that you are experiencing PPD and should consult a doctor right away. Don't keep these feelings to yourself. So, what causes postpartum depression? There is no single factor known to cause PPD. While it is linked to a mother's hormones, specifically estrogen and progesterone, there are other contributing factors. These can include, if you've experienced PPD with a previous pregnancy, you are more likely to experience it the second time. If so, prepare for the possibility of it happening again. A lack of help and social support from your partner or family, so plan ahead, arrange help, and put a support system into place. C-sections can be a significant contributing factor. The subsequent pain and recovery associated with cesareans can also certainly compound with other PPD symptoms. The variability surrounding a multiple birth is also a factor. Multiple births don't always go as planned, or don't always seem ideal. The babies may be premature, and they may spend time away in the NICU. This can also lead to feelings of helplessness and depression. After birth, the focus of your friends and family can often shift from you to the newborn children. This shift in attention can sometimes be hard to handle, especially at a time when you feel you need the most emotional support. Adjusting to your postpartum body and not feeling attractive or particularly well can also contribute. The early weeks and months are often the most difficult, and caring for multiple infants is a challenge for everyone. Realize you are not alone. Sometimes, for different reasons, a parent of multiples can experience a preference between the babies. This can also lead to feelings of guilt and shame. This is normal. Challenges with breastfeeding can also lead to anxiety and guilt, and also sleep deprivation. So don't be afraid to ask for help. Remember that if you feel any symptoms of PPD, don't be afraid to seek help. Share your feelings with your partner and consult with your doctor. You should never feel shame, as postpartum depression is a common illness. It's important to take care of yourself. Every day, do something for you. Taking proper care of yourself is important for your overall health and your ability to take care of your babies. And remember, you don't have to do this alone. Ask for help from your partner, friends, family, and community. All right, so that's a summary on recognizing the signs and symptoms of postpartum depression. So now, if you feel them cropping up, you'll hopefully recognize them and get any help you might need. Like we mentioned at the top of the show, we've put together a printable list of the signs and symptoms. So you can print that off, keep it handy, and share with your partner, friends, or family so they can be on the lookout for signs as well. Visit lifewithmultiples.com/PPD and we'll send you that today. That's at lifewithmultiples.com/PPD.
Thank you so much for listening to this episode of the Life with Multiples podcast. Until next time, stay healthy and be well.
If you're a new or expectant parent of multiples, the Life with Multiples Academy is the place to get the information and answers you need. To learn more, head over to lifewithmultiples.com/join.